My name is Mary Benetti, and I serve as the Senior Policy and Program Specialist for the Institute for Patient and Family Centered Care. Can you mute your speakers? Are you on a phone? It's important to use one or the other, your computer speakers or your phone, but please don't use both. So I am welcoming you to our virtual PFCC Connect conversation about patients and family advisors as faculty and trainers. And I'm joined by my illustrious colleagues, Ushma Patel, who is the Director for Special Projects and Educational Programs. You want to say hello, Ushma? Ushma may be on mute.
So sorry about that. Hi, I'm Ushma Patel. I'm the Director for Special Projects and Educational Programs at IPFCC. I manage our Special Projects team and help organize and plan our conference that we have every 2 years, as well as our seminars. So I see some familiar faces from those previous events, and I look forward to talking with you all today.
Great. And Ushma's going to be our chat moderator, so she'll be watching. A number of people will choose to, sometimes people join in a common room where they need to not be on the audio, so they tend to chat in. So I encourage people to watch not just the monitors and the beautiful faces we have in front of us, but also the chat. And Ushma will be moderating that and helping us know if there's something that we want to be sure and pay attention to in the moment. Annette Lee is our healthcare program and communication specialist, and she's the person that puts all this technology together and makes it work. If you are having some difficulty and you are in the chat, you can send a chat just to Annette, and she can help you kind of behind the scenes work out any issues that you might have. I think the biggest issue often for people is remembering to mute their phones, so that during the conversation, unless they're speaking, there isn't any background noise. And it sounds great right now, so I appreciate you doing that. Annette, did you want to say hi, Annette? It may be that she's on mute too. So in terms of managing the time, if you want to go to that next slide, that's great, Annette, thank you. We do want people to chat in their name and organization, and we're going to use some polls to learn about those of us that are on the call today. We've got 23 people on the call. We've got a few more registered, but I know that this call is being recorded, and we will put it in the PFCC Connect space under a special file folder called PFAs as Trainers and Educators, and then it'll always be available for people who weren't able to join the live call. Our main goal isn't to present to you as in a webinar format, but it really is to learn from each other what people are thinking about doing, what they're actually doing with patients and families in partnership. I'm hoping that we've got some patient and family advisors on the call that are working in this space and working with organizations as educators, because we want to hear everyone's perspectives. And if you have resources or ideas, again, in order for us to capture it, we appreciate you sharing it verbally, but also if you have a link to something that you have found particularly helpful in developing these partnerships with patients and families in educational settings, we'd love for you to share those resources and ideas. And it looks like we've got people from all over the place. So this is great and very exciting. You want to go to the next slide, Annette? So the first poll that Annette's going to bring up is for everybody to identify what their healthcare setting is that they're working in. Some of you may be with hospitals. Often, even as you type in where you, what organization you're working with, it may not be clear to everyone on the call. So it's really helpful for people to do this quick poll, and then we understand where are the settings that people are most often working. We want to be talking about all the different settings, but it's good to know who's in the audience and participants in the call. So if you can just identify that really quickly, And Annette, I know you're monitoring that, so if you feel like you've had good response from our participants, we're up to 26 now, please go ahead and show us the results of that poll. Okay. Wow, the majority of people are in hospitals or medical centers. I'm always glad to see community and nonprofits involved, so thank you for joining, as well as primary care, where I spent a fair amount of my time before I joined the Institute for Patient and Family Centered Care. Very close to my heart. So we'll move on to the next poll. My guess is that a lot of the conversation will be about hospitals and medical centers. However, I have had some experience in working with patient and family advisors in those other settings, and I hope those of you on the call have as well as educators. So let's see who's in the virtual room as we look at the current roles that people play in different organizations. So take a minute to scan that and identify what role you believe you fall into. And if we miss something as a role, please feel free to chat it in. I was recently reading a journal article about the importance of interdisciplinary teams and involving people from a variety of perspectives. And I think my hope is that in this call, we've got people from a variety of venues and in different roles so that it enriches our conversation. So it looks like we almost have 50% who are patient experience and patient relations personnel. That's some patient and family advisors and people who are responsible for PFCC initiatives. Great. Well, this is going to be a great conversation. Thank you so much. Next slide, Annette. Thanks. So one of the things that we feel really importantly at the Institute for Patient and Family Centered Care is the value of everyone collaborating in the education of new healthcare professionals. Please mute your screen. Sometimes when you get that wah, wah, wah sound, it may mean that you're on both the phone and the computer. So if you're on the phone, please mute your computer speakers. So we have a special area in our www.ipfcc.org, our web page, under PFCC best practices related to partnerships in interprofessional education with patient and family advisors. And it's got a variety of resources. So if you aren't familiar with that area as a place where we kind of highlight some best practices and things, we encourage you to go there, not necessarily during this conversation, but I wanted everybody, because sometimes people have to leave a little early, to know that that resource exists. Because we like to, what we do in IPFCC is we go out and we find out all the great things that people are doing, and then we like to bring that information together and summarize it and make it available to people who are just getting started on the journey. And I really appreciated that there were a number of you who took the time to identify what were the questions and the areas of discussion that you really wanted to participate in, because this conversation really is going to be led by what's important to those of you that are on the call. We can go ahead and go to the next slide. So our website, of course, talks about all the different ways that PFAs are utilized as educators or trainers. But we have one more poll because it's important to know who we have in the room. And so here are some of the ways that patient and family advisors can partner with you and participate as educators. And what I would love for you to do is check any that apply to your organization, or if you're a patient and family advisor, that apply to what you're doing as a PFA related to being involved as a trainer educator. And again, if I didn't list every possible way, because there are many and we're very creative in our organizations and each organization is a little different, please feel free to chat it in. because we want to be able to know what those other ways are. That was one of the questions that came up a number of times as people registered, was what are other people doing? How are PFAs being used, patient and family advisors? So if you can just take a minute and click every that apply. And there may be some of you that your organizations aren't yet doing this. You're just getting ready to start this journey. And it's great that you're here too, because we want to share the learning. And then as you begin your journey and have your own learning, then you can share it back with us. Looks like there's some great information happening in the chat as well. And here's the poll results. So we've got 78% of the population, or of the participants, really are utilizing patient and family panels, which is a group of people with different experiences or individual stories. Always glad to see patient and family advisors involved in new employee orientation. It's a great way to really communicate the importance of partnership in your organization. And always good to have patient and family advisors helping to train and help new healthcare professionals understand the experience of care from the perspective of patients and families. Great. So there are also some other things that have been chatted in, and that's really great. What I want to do is go ahead, we can leave this slide up. What I want to do now is, actually I want to go to the next slide, which is really the key areas of discussion. Sorry about that, Annette. So these were the kinds of questions that came up as people registered for this conversation today. And my role as the visual moderator is to really just launch the conversation and the questions, and then we'll see where it goes, and I'll kind of manage the time to see, to ensure that we get to most of these questions in some way or another. But let's start in the general area. So we've just done a poll, and we've seen that a lot of patients and families are used in panels and in stories, but they're also used in simulations and in other ways. What people were interested, and I think this is a really important question. What is the response in your organizations to the different ways that patients and family advisors are involved, and what value are they bringing to that particular area, whether it's in a simulation or if it's in a panel with new residents or new healthcare professionals? And so it often is helpful to have individuals who are on the call just kind of share what they are thinking about doing or what they are currently doing. And so I often just talk with a couple people prior to the call and ask them if they'd be willing to share the information with of what they're doing to just launch or start the conversation. And Kristen, I know that you're on the call, Kristen Woodruff from Tampa General Hospital. And I'm wondering if you want to share a little bit about what you're doing with patient and family advisors, or what you're planning on doing related to patients and families as educators. And if you're on mute, you would certainly want to take yourself off mute so that we can hear from you. Kristen? Oh, we may have lost her. I know she was here earlier. Well, Joy, I did see you as I scrolled through the beautiful folks that are here, and I'm wondering, Joy, if you want to share what you're doing at Seattle Children's. Oh, we don't want to, yeah, leave it on that slide.
Sure, can you hear me?
I can, very well, thank you.
Yay, okay, so Yeah, let me think how to share a little bit succinctly, and then if people have questions about specifics, I'm happy to share more. But so currently, and actually for quite a long time, we've had family advisor panels for every new nurse who is hired in our organization as part of their general nursing orientation. And I think you were asking about how things are received by the organization. We're consistently told by nursing education that that is one of the nurses' favorite parts of their training, which, you know, partly it's not very heavy on learning of details and memorizing things, but it's also really something I enjoy facilitating because it is such a meaningful time for brand new nurses, sometimes just brand new to our organization, or sometimes from our nurse resident program, so new graduates, to have a little time to sit with some experienced parents and ask them about what it's like to partner at the bedside to care for their children, what it's like to live in the hospital for long stretches of time, just all of those things that they can't necessarily ask their patients as they interact with them or those families. But this gives them a space for that. So that's one of our areas. We have a couple of different groups of residents here who come through on their specialty rotations that might be 1, 2, or 3 months, depending on the program. For example, anesthesia residents, surgery residents, we have a panel with them. We try to get them on their first day here before they have actually interacted with families. And that too is a pretty high value, because what we often find, one of the first questions I ask for the anesthesia residents, for example, is, have they ever worked with children before? And often the answer is no. So it's really a chance to share some ideas and concrete skills on how to interact with children and with families in that really tense space of anesthesia pre-surgery. And also for them to ask questions that might be on their mind about, you know, what it's like for families to be here on days like that. So those are the two really long-standing things that we do here. And then there's a panel for our Seattle Children's residents who come to our 3-year residency program here. They have a parent panel as part of their retreat, sort of 3 months into their time here, which is also always highly scored in their surveys afterwards. So those are all kind of the parent panel, sharing stories sort of settings. There's 2 things that we started doing recently, or started exploring recently. So if I can take a little more time, I'll describe those as well, and then hand off. One of them is a partnership between our Family Advisory Council and our resident education program. And that, interestingly, grew out of the head of the resident education program came to the Family Advisory Council to hear from those parents just what it's like to bring your child to a teaching hospital. And she got an earful, because it's hard. It's hard to navigate healthcare, and when there's residents involved, that adds a layer. But she was great, and she came back for a second discussion several months later, and what grew out of that was a partnership that we launched last year with a small group of residents, a small group of parents, a subset from the Family Advisory Council. And we spent last year discussing what are things that residents could learn from parents over the course of their 3 years here that would be of a high value for them. And this year we're planning to implement a couple of those ideas. So that's one new piece that I'm excited about, because it's hard to get into resident education because they're so busy. It's very full already. So this was a great win, I felt, in getting kind of parents into that space and creating a partnership that people are really seeing the value of now. And the second thing is partnering with another teaching program here at the hospital that was developed by providers for providers around communicating, how to communicate with patients, how to connect and create empathy, and more specifically in some of the workshops, how to communicate in moments of high emotion. And that program developed over the last 4 or 5 years without parent involvement, but this year we've started bringing parents in to be part of the discussion, to answer questions, and also to be part of the role play sessions at the end of these workshops.
Oh, that sounds wonderful. So how do you?
It's been pretty exciting.
Yeah, I bet it is. The other thing that I think is great about what you were discussing is the fact that you brought parents in for these panels and these stories with residents, and out of that grew a real interest in developing and deepening the partnership and planning beyond that. So what you really did is you engaged the residents through those stories and those brief interactions to really build longer term relationships and really in a systematic way think about where the value proposition is for integrating into residency programs. And I do know that I've heard from others that getting time on the residents' busy schedules is really difficult. And so that was a really wonderful way to do that. So thank you, Joy, for sharing that. Are there others that would like to talk about what they're doing? I noticed as I was scrolling through the chat that there are a number of questions and comments that people have made, but I noticed that Catherine has this question, and I'm opening it not just to you, Joy, but Joy, you can certainly answer first, but there are others that I know that there are others on the call that have programs, but how are people preparing parents to sit on panels or to be involved in role plays? Preparation is really important. So
I'll jump in just quickly. I mean, we have a family advisor training for onboarding our family advisors in general that addresses storytelling and how to share stories, because not just in education spaces, but many other spaces, that's what we find to be the most effective way for families to contribute and I guess open up hearts and minds to what they have to say. So we do a specific training around how to turn your story into like a 30-second or 60-second anecdote, how to take out all of the pieces that are super important to you as a parent, because I started as a family advisor here, so, but don't matter to the story that you're telling in the same way, and how to keep in those details that really make it impactful. So we do prep around that. I prepare the parents for the panels with the residents and the nurses with sharing the types of questions that get asked and making sure that they have a few stories to share that would speak to those. That's our kind of basic preparation for nearly any family advisor role. For the role plays, that's new, and we're sort of learning how to go about that. So if others have more experience in that, I would love to hear from them as well. We're about to do our third session where we have family advisors in role plays playing families. And what we found difficult is we want them to play families that are perhaps more challenging in the way that they communicate or experiencing their highest emotions for these workshops. And that's not a natural gift for everybody. We're not all actors. So it takes some acting to do that. And we're sort of learning how to prepare people with more specific scenarios and really stating outright, pretend this was your worst day, for example. If we're looking at a simulation of a highly emotional conversation where it's hard for you to share what's going on and you're having some difficulties with a nurse inpatient or whatever it might be.
Mm-hmm, mm-hmm. I noticed that there was a question from Jennifer about some of the common questions that come up in a panel, and one of the things that is available on our website is preparing patients and families to be on panels. We also have a publication that was written by advisors for advisors, but a really good couple of questions for panels that I might recommend, and then I'm going to open it up to the greater audience, is, what's worked really well in your experience in receiving care for your child or as a patient who recently went through surgery? And then what's one thing that you would have wished would have been different that could be improved? And it's always good in panels to start out with the positive question first, because sometimes it's really hard for healthcare professionals who care very deeply on doing the right thing to hear the negatives and not have it balanced out by the things that went well. So, and the preparation for a panel really is to let the panel members know ahead of time what the questions are and to kind of just chat with them a little bit to help them understand the process and answer any questions that they have. You do want to be able to provide people with support. So I noticed that Joy, okay, so I'm hearing a bit of an echo, so I'm thinking maybe somebody's got both a phone line on and their computer speaker line on. So if you just mute your computer speaker, that would be great. Thank you. Joy is willing to share information, and so since we are creating this folder in our PFCC Connect, if there are others that want to share information and resources and things, if you would just send them to events@ipfcc.org, then we can make sure everybody gets access to them rather than inundating Joy or others with individual, not that you can't follow up with her, but to get the basic information into our PFCC Connect where it can be shared broadly. Thank you, Joy, for sharing. I'm interested in knowing if there are any patient and family advisors on the call that have served in educational roles or been on panels to talk about what your experience was. And remember, you may have muted yourselves, so double check that.
And Mary, I believe Kristen also recalled in, so.
Oh, great.
As well.
Okay.
Kristen, are you there?
I know that she was having some trouble with her phone, even though she wasn't on mute.
Can you hear me okay?
Oh, we can now. Great.
Okay.
Yes, Kristen.
Great. Hi, I'm so sorry about that. Yeah, I did want to share Julie with one of our patient and family advisors. She is on the call now. She has actually been on our planning committee for a QI initiative for a resident, physician residence communication and training program. It's going to be for 2020. And so we're very new at it ourselves, but we're kind of involved in this call to try to get some more ideas. But basically, every month is going to have a specific focus for communication efforts and improvement of patient-centric communication and behaviors that can be observed and measured throughout the year with our residents that are coming through our academic medical system. So we're in the planning stages of that and definitely want to use our advisors. We have a fairly large general PFAC, and several of them are very interested in getting involved with residents training. We kind of have envisioned the same thing, the panels, the storytelling, perhaps skills practice or role playing, things like that, and simulation type things. But Julie has been active on the committee to help kind of see what we're planning and say, hey, that sounds good, or maybe that needs reworded. So it's been important to have her on the committee, and we're hoping to use a lot more advisors moving forward in the actual initiative as well.
Great. Julie, I know that you're on mute right now, but if you can take yourself on mute, off of mute, would you be willing to just share what the experience of working with others has been like on this planning for the communications training?
Sure. Can you hear me? Okay.
I can.
Okay, great. Thank you. As Kristen said, I'm still new to this, and now I'm sharing this QI initiative, which we still haven't named yet. But it's a very interesting to me to be able to help and give back to the community in this way. I have been a patient with Tampa General Hospital, and my husband has also, so I'm coming from also the patient and the family perspective on that.
Mm-hmm.
But this is all new to me still, and this is why I jumped on here also to learn from you possibly, and to, like Kristen said, bring the patient perspective to it.
Mm-hmm. Mm-hmm. Great, great.
Yeah, I'm sorry. I'm not exactly sure what to say. I'm nervous about that one.
No, you did great. You did great. I think it is a new role. Having patients and families involved as educators and faculty is not a broad thing. There are a number of exemplars that are out there, but it's kind of new territory. And so we really encourage individuals to know that, in a sense, as you're working with your group, Julie, together, you guys, from your experiences and their experiences, are kind of, in a sense, making it up as you go, figuring out what makes sense for your program, creating the opportunity to think about the key core concepts of patient and family-centered care, which is respect and dignity, information sharing, collaboration, and participation. And so when we invite patients and families into participating as educators, we want to make sure that we support them, and we also want to involve them as early as possible. So what I really love about Kristen and Julie, what you're doing is you're really co-designing how you're going to approach this, as opposed to educators developing the training and then at the end pulling patients and families in. The conversation about what adds value, what's important from the patient perspective as well as the educator's perspective is key to create that kind of balance. Are there others that have been doing this kind of work there's a question around, and I'm not sure who, I think Catherine had the question. I'm curious about when a patient and family is an educator, how do you invite clinicians and healthcare professionals to participate and feel comfortable about that? So one of the tenets is no surprises. So as you're developing a program, then you're sharing with your residents or others that patients and families are part of the way we train in our organization. And that can be shared at orientation. It also is important, and I know in primary care, we at Peace Health Medical Group had a patient advisor trained to be a shadow coach for clinicians and healthcare professionals who are doing primary care work. And so one of the observations that she made was that it was really important as you were meeting with the provider prior to the shadowing to really talk about the things that you were going to be looking for, and then when you're debriefing with the clinician to really focus on the things that they did really well, and then share only just one or two things that could be improved as opposed to making a huge laundry list. And that kind of creates the opportunity for people to kind of relax. Are other people able to? Now, Joy, it looks like you responded in the chat to Catherine. Did you want to share how you have been doing that in your program? Because you've been at it for a while.
Sure, I'm happy to do that. We've found through trial and error a little bit that it's really helpful to open up the conversation in a way that is not starting with questions from the audience. So, often a standard panel, parents will sort of share stories based on maybe moderators' questions, and then we open up to questions from the audience, for example. And sometimes that's what works best depending on the size of the group. But in some of the smaller groups that we do, or even the larger groups of new nurses, we've found over the last couple years, and I worked closely with a family advisor who now facilitates some of these groups herself and kind of figured these pieces out. So I was really happy to learn from her. That if we start by asking them some questions, the people in the audience, that help them get used to using their voices in that room and share some of their own vulnerabilities, that helps create a discussion that's much richer. So for example, with the nurses, we often start by talking about just very briefly what patient and family-centered care is, and then saying, we know that you do this already in your roles, because the nurses have already started working on the floors with their preceptors by the time we see them. So, why don't you share with the group some things that you do that are family-centered? And that has been a really successful way of getting nurses to open up and share skills with each other and sort of recognize the things that they're doing that are already patient and family-centered. And we found that it opens up to some much deeper questions when we do that. For the residents, for the anesthesia residents, for example, who come in on their 3-month rotation, having perhaps never interacted with a child before, I ask them as part of their introduction to share either what they're looking forward to the most in this rotation and or what are they the most perhaps nervous about. And we get some really honest answers that way. It's really changed the tone of the sessions to start off that way. And so I think that helped shape how we approached this family resident partnership as well with the Family Advisory Council and medical education group, because we started with some sessions where we just said, you know, residents, could you share with us things that you would really want to hear from families or things that you find really difficult? And they did. And in those first sessions, they learned things from parents. For example, one of the things that came up was rounding, that rounding is really hard for them, that they find it challenging to be told that they have to do family-centered rounds, but they don't really know what that is, and that there's a lot of other pressures on them during that time. And one of the things they were saying in the group was, and do you families really care? Do you want to be part of rounds? You know, and the family said, yes, yes, we absolutely value rounds. And so here's some ways to make that valuable for us. And it just, that opened up one of the key topics I think we'll work on this year in helping residents understand and feel confident in how to approach rounding in a family-centered way.
Great,
So,
great.
just
Thanks.
some examples.
Yeah. Now I know that Cheryl Chadwick is on the line from Children's Mercy in Kansas City, and she mentioned something about how they are exposing residents to patients and families. Can you come off mute for a minute, Cheryl, and just share a little bit more about the work that you're doing with your 13 family educators?
Sure. So during the first week that the residents are at Children's Mercy, they actually have lunch with our Family Advisory Board and our Teen Advisory Board. And it's actually geared to just be a very casual conversation. We want them to get to understand that patients and families are partners in their care. So we actually put out like conversation starters, just, you know, things like, where'd you go to school? What do you like to do for fun? To just get them to have that conversation. So then when they're doing their developmental and behavioral rotation, because that's when they have the most time, we've got 13 family educators who are co-trained by my partner, Dejo Miller, myself, and our Director of Graduate Medical Education. And they go through a 2-hour training in order to learn to be educators. And they are all parents of very medically complex children. And they actually invite, we coordinate the invitation to that they host 2 or 3 residents in their home for a 2-hour period of time. The family educators do get a stipend for doing this, so they provide the residents with dinner, and then they get to choose the information that they share with the residents. Many of them show them the equipment that they have in their houses, how they've adapted their homes. They may show them their medical cabinets. They may actually show some of the procedures that they do with their kids. Then the next day they come back and do a debriefing session with Dejo and myself to talk about their takeaways and the strengths that they saw in the family, and then what will they take into their future practice. And then we also have another group of patient family advisors that host a panel, and it's called What Mattered Most. And these are all patient family advisors who are parents of children who have passed away. And so before the residents go into their second year, which is their critical care rotations, these parents, we have 4 parents on a panel come in at a time. Sometimes it's a single parent, one parent, or sometimes it's the couple themselves. And they kind of tell their children's story, and we've kind of worked with them on how to tell their children's story. And then they talk about what mattered most and what those takeaways that they remember, those phrases that people said to them that were really helpful in that most difficult time, and maybe opportunities where things maybe could have been said a little better, that those things that hurt their heart and they still remember.
Mm-hmm.
So that's one of the ways that we use advisors. We also use them for like our Nurse Leadership Academy panels, as well as the graduate nurse residency panels. as well as panels for social workers. And we just recruit our patient family advisors from our pool. We have about 200 of them, and we recruit them kind of based on their experience as well as their interest.
Great. And you were talking about the 2-hour training that you do with the families. What do you cover in that training? What's really the important takeaways that you want parents to have?
A lot of it is on how to be an educator, and that's why our graduate medical education conducts the majority of it. They've got like a PowerPoint and trainings that they go through to actually, they want to teach. Our goal is to teach the family of how to share their personal story in a way that's going to educate our residents. And they actually use this as part to fulfill one of the requirements for graduate medical education.
Great, great. I'm looking at the time, and we've got about 15 minutes left, and we leave about 5 for me to wrap up and just share a little bit of information. But I'm looking at the questions that we received when people registered, and I know that this is an important question, and so I want to just pose it and see what people, and I don't have anyone identified to share the information or respond to it, so I'm really hoping that that people will just speak up. But it has to do with an implementation issue that relates to equity. It says, how do you address and ensure that diversity and inclusion is a large issue to consider for PFAs in this role, so that your educators, your parent or your patient educators represent the populations you serve and aren't all from one particular demographic or ethnic group, but that it is more broad. So I don't know who might want to share, but I'm very interested in this. This is an important question, and we want to make sure diversity is represented, because residents and nurses are going to see a whole range of people in their practices. Who would like to take themselves off mute and respond? It looks like, Jennifer, you had something about what you're doing.
Hi. Yeah, we actually, this came up towards the end of our session last year. And we actually went through and identified some of the different clinics, outpatient clinics, and looked at ourselves around the table and identified kind of where we're at, who's and what type of populations are missing. Are we covering those that are in poverty? Are we covering those who aren't in poverty? Who have developmental disabilities, you know, that whole wide range. And then we reached out to various clinics and MDs and stuff to see if we could get names and stuff of people that would fit in there, to try to, that we then reached out to see if they might be interested in joining us.
Great, great. And have you had good response from your clinics and your clinicians in identifying some folks to reach out to?
It was actually one of our better responses that we've had. And we're a fairly new advisory council. We've only been around 3-4 years now. So this has actually been the best one so far. We have like 6 new advisors coming on starting actually today. So.
Oh, wow. That's great. That's great. How about, thanks for sharing, Jennifer. How about others? What are activities or efforts that individuals are making to ensure that their educators, their parent educators or patient educators or family educators are a diverse group? I'm going to wait just for another moment, because I know that people are on mute and you may be talking to yourself, but not to us.
Hey, Mary, this is Catherine Raymond. I'm at the Cystic Fibrosis Foundation.
Yes, hi, Catherine.
Hi. This is just a tiny little anecdote, but we did some focus groups with advisory councils in our community, and one of the things that they recommended to offer offer opportunities for people who are maybe lower income or single parent families who just maybe don't have as much time. They suggested that there are more sort of one-off opportunities for them to be engaged with, quality improvement initiative, or maybe like a you know, a way to share their story that is then included in an educational presentation, but that you meet that person in the clinic when they actually come to the hospital, and you ask for another 20 minutes of their time, and then grab a story from them then, or ask for their input on a survey. But those are some of the tips that they suggested. They know that, you know, once people go home, they're just so busy that they don't have time to re-engage.
Mm-hmm.
So if you can catch them when they're in the hospital or in the clinic space, then you might be able to invite their voice in a different way.
Mm-hmm. Mm-hmm. I think that's a great idea. And it really speaks to how we meet people where they're at, and we try to not create undue burden by inviting them to participate in education, but look at what's going to be most useful and long lasting. I know that in an organization that I worked with, they started by having patients come and tell their stories at new hire orientation. But what they looked at was that they were doing new hire orientation twice a month, and that was kind of a burden for people. And so they actually put those stories into video so that patients did it for about 6-8 months, but then they were beginning to say, you know, this is really, I can't always be here Monday morning at 8 o'clock. And so that became another vehicle to make the connection. And then patient and family advisors were able to participate and have an impact, but didn't necessarily have to have a negative impact for their own schedules and things. Are there other ideas that people have related to diversity and inclusion?
Hi, Mary. You go right ahead, Thomas.
Yes, hi. My name is Thomas Emmer with Anne Arundel Medical Center.
Hi, Thomas.
And I'm a trained professional. Done a lot of work with development, teaching, all types of quality type of classes. And one major tool over my experience has been extremely effective, and that's benchmarking, where you're able to see what other type of university or what type of facility, how they handle their training issues and that type of thing. So we're doing that where we are here at Annapolis, Maryland. But a lot of that too also, I think, builds in the role playing. You know, you brought that up earlier. There's a lot of power to that, and getting the families involved with it as well. Getting the, I guess, the feedback, exactly how much more we can work with the diversity and equity. So I've been in a number of subcommittees with safety, vendor visitation, family presence, and quality issues, service excellence. So a lot of those committees we find that role playing is effective for all of them, plus others.
Great. I love that you guys are doing benchmarking as you're creating your work in your own institution. So that's great.
That's been very effective.
Great. Thanks for sharing. I think there was someone else that was going to be.
It was me, Julie.
Hi, Julie.
I'm actually in a wheelchair, and when I spoke with Kristen asked me to join the PFAC, it's been really neat being on the planning side of a committee, because she asked me to be the chair of the subcommittee for training new doctors coming in and handling the patients and how they're going through everything. And it's kind of neat for me that they're actually listening to what I'm saying. And, it is a lot to learn, and they do have a lot of technical things that's a little bit overwhelming. But I feel very included because they're actually listening to what I'm saying and using some of the ideas I have. So, it's not only just for, walking people, you know what I mean? You have to kind of include, maybe a voice of a handicapped person too, because, there's a lot you have to deal with in a hospital or a medical situation with handicapped people that are just a little different than just regular walking people, if you know what I mean.
You
So,
bet.
yeah, so I think it's like really neat that they included me also.
Mhm.
And it's important to have different people from different walks
Mhm.
in your PFAC committees.
You bet. You bet. Yeah, we need to, it's a great reminder, Julie. It's a great reminder that the uniqueness and diversity, you know, isn't just ethnic diversity, but it can be physical issues and challenges,
Exactly.
things like that. So it's a good point. Great. So I interested to hear from Joy or Cheryl or those that have existing programs, but HIPAA and volunteers always come up in implementation, whether we're talking about patient and family advisory councils or even in this conversation about patients and families as educators. And we have some material on our website about that, but what I would say about this generally is that HIPAA does not prevent us from inviting patients and families to be educators in the organization. That if patients and families want to share their stories, and if they're going to hear stories in interaction from the organization, going through normal confidentiality procedures and preparation is important as foundational to anything, whether they're volunteers or their staff or their patient and family advisors. But HIPAA is not a barrier to embracing the invitation of patients and families as educators into our organizations. Cheryl or Joy or others, does anyone else have anything to say related to that? In their organization, have there been barriers that I'm not aware of?
This is Cheryl. We have all of our patient family advisors. They have to complete the volunteer requirements that all of our other volunteers do. So they have an orientation, they have a background check run, and for those that are going to be in the hospital or that like are badged, that actually have an ID badge to gain access, then they also have to get the required immunizations and have the blood titers. And so we treat them no different than we do other hospital volunteers.
Great. Thanks.
Yeah, this is Joy. I would say similarly, our patient family advisors sign a confidentiality agreement, and those things are made very clear with respect to HIPAA. So one thing I'd also add in that arena is part of our training for our family advisors is to think about the stories that they're going to share and whether they are ready to share them. And also if it's really their story to share, because we're a pediatric hospital, and I myself, as my children arrived into the teenage years, realized that their stories were no longer necessarily my stories to share. And so we just prompt thinking about that aspect as well.
That's a really important, that's really an important point, and something that as a parent I need to take to heart. So thanks for sharing that. There was one other question, and then I'm going to kind of wrap things up. And that has to do with, in terms of programs, are any of the people on the line, as your advisors are serving in training and faculty roles as volunteers, have you ever integrated a parent or a patient advisor into a paid staff role and hired them to be educators they then become part of the organization, but they're bringing that perspective into a paid position?
This is Joy again. We do have a patient family advisor on our family experience team. So she participates in panels. She's not specifically dedicated to education, but her role is to be a family advisor, and she is on staff on a per diem basis. And I got my start as a family advisor, so came to this work from there. I'm currently advocating for hiring, in some capacity, some parents to actually manage the education program. I have no idea if I will get there, but I think there'd be great value in that because in some ways there's no reason for me as a facilitator to be in the room. I think some of those conversations can happen between well-trained family advisors and residents without any extra administration going on.
So this is Cheryl again.
Yes, Cheryl.
And Dejo Miller and I are both paid patient family advisors. We were hired over 11 years ago at Children's Mercy, and we started part-time, but now we are full-time employees. And we are truly patient family advisors. We continue to stay in that role, and we do lots of the education. The other thing that we do is recruit, train, and manage the members of our 17 patient family advisory councils and the other PFAs that we have that don't sit on those councils. But we are truly PFA focused and remain that way.
Great, great. Thanks for sharing, both of you. I often find that organizations that are mature in their utilization of patient and family advisors often create paid positions. I'm sensitive to the time. I know you guys are busy people. I appreciate that you've joined the call. I have a couple slides to share with you. And so, Annette, if you can move forward in the slides. I noticed that one of the conversations was about, would we provide support for people to download materials into PFCC Connect? And the answer is yes. If you are having difficulty figuring out how to get the information that you've shared and the materials into PFCC Connect, Annette Lee can help you with that. And at the end, you're going to have a slide that has her email address. I just want to share University of Arkansas for Medical Sciences uses patient and family educators in the 4 ways that we think are most important: in co-design and planning of curriculum, which is what Julie's doing with Kristen, development of curriculum, delivery of curriculum, and then evaluating the effectiveness of the education. And so I'm not going to go into any more detail, but as you're thinking about starting your programs or expanding your programs, I encourage you to think about, are we utilizing our partnership with patients and families in each of these 4 important areas? Next slide, Annette. Prepare patients and families as educators. On that special projects right-hand side of our website, there's, as you drill down into that special topic area, there is information about how to prepare patients and families as educators and access to other resources. And we will put that link into PFCC Connect, but if you're excited and don't want to wait for Annette to send that out, feel free to go to our website. Next slide, please. I love that most of you are PFCC Connect members. If you know other people, patient and family advisors, or others in your institution that you want to become members, it's a free online learning community, and I really encourage that. The more members that are interacting with each other through chats and other ways can really help us all to learn and grow. Next slide. So what we're going to do is, we have recorded today's conversation. We're keeping a written chat record. We're going to put today's slides and all relevant IPFCC links from our website into PFCC Connect under a file folder in the library called PFAs as Educators / Trainers. And we encourage you to add additional links, examples, tools, or resources, continue the conversation with each other, pose questions. And again, Annette Lee can help you and assist you in loading anything onto PFCC Connect if you need that assistance. She's just she's gone to graduate school, but she stayed with us for 2 days a week. So she doesn't respond immediately to your email. She does work on Tuesdays and Thursdays, so she will get to you. Next slide, Annette. So I want to end the conversation just a minute late, but I want to thank you all for joining us. Our emails are there. Ushma did a great job of moderating and responding to chat things in the chat space. So thank you, Ushma, and thank you, Annette, for providing the technical support. And thank you all for listening in, for participating, for chatting in, for sharing what you're doing. That's how we all grow and learn.